Thank you very much. Uh, Delighted to be here and be a part of this singular event. The fact that you're at the very beginning of this journey, it makes it doubly exciting. So, but to see implementation being considered right from the very beginning as a part of your ITTC network, that is a wonderful thing. Uh, Having been at this now for over 50 years, it's been a struggle to get implementation onto the agenda, but here we have it not only on the agenda, but it's also a primary thing that you're considering from the beginning. So I am going to, you're going to get 50 years of information in the 30-minute university. And so we know about the benefits of one-time kind of information. So we'll talk more about that as we go along. But to reach policy goals is really how can we take the science and get it into practice? I mean, that is what you're all about, and it's what we are all about. So we'll get through this, and please do monitor my time as you promised. So here we have, I need to change this so I can see better. There we go. So here, let's talk about technical assistance. And you're all familiar with this. There's the universal level, the targeted level, the intensive level. And the investment of time, energy, thought, etc., goes up as we go along. What we think about this as letting it happen, helping it happen, making it happen. So at the universal level, we're kind of putting information out there and hoping for the best. A lot of communication that goes on. The targeted level is where we get to be more specific with the information that's being provided to more select kind of groups to help them understand what needs to be done. And then in the making it happen category, this is where we want to really see the benefits. And the benefits in terms of outcomes vary. We've been, as I said, our first implementation failure was 1971, and we've been heavily involved in trying to figure this out ever since then. But the data are pretty clear that at the letting it happen level, you're reaching a lot of people. Anybody can come find the information, but the benefits in terms of actual change to benefit recipients of services such as you all are interested in is pretty modest. But in the letting it happen, it's the recipients of the information. It's up to them to go find the information, make use of it as best they can. They are responsible. The same is true for the helping it happen category. The recipients still are responsible. Sign up for the webinar like you did today, for example. Go to the website and download materials and read them thoroughly. But still, when it's all said and done, how you use and if you use the materials is still up to you as a recipient. And 5 to 15% success is typical, and this is across many, many fields. So it's not just substance abuse, it's any of the human services. Where you want to be and where your network is most interested in is the making it happen category. And this is where you as a TA provider, you are an ITTC member, you have your center in whatever one of your 65 countries that are here on this telephone call. You are going to take responsibility for assuring that outcomes, the desirable outcomes, are occurring. And you can get to 60 to 100% success in that category. So universal, targeted, intensive really translates into very different sets of activities. We're all very familiar with the letting it happen, helping it happen, the universal targeted areas. This is how many of us have spent most of our lives. So we're used to those kinds of things. So we're going to focus on in the next few minutes on the intensive level. The intensive level is all about change. So here we are, as I mentioned, as an intensive TA provider, we're taking responsibility. We want to change outcomes. Well, to change outcomes, we must change behavior. Practitioners have to make use of evidence-based practices. That's different than what they used to do. They need to learn these things. Organizations are not set up to support evidence-based programs and practitioners making use of them. So they need to change, and system managers and funders need to change as well. So you as an intensive TA provider, guess who gets to do this work? It's you. You are responsible for helping these things change. So the challenges then are many. The first big challenge that we run into in just about every category of human services as we go from substance abuse to delinquency to child welfare to public health and on, we often find that people are trying to make good use of and to help other people make good use of interventions that are not well defined. Maybe the evidence is pretty clear, but the intervention itself is not so clear. So getting past this first problem is an essential first step. It is difficult to do something well when we don't know what it is. It's difficult to teach other people to use it when we're not really clear about what it is. So operationalizing interventions is a key thing. But again, who does this? Intensive TA providers. If it's not well defined already, it's your job. Lack of existing implementation capacity is a huge problem. This is not a part of human service systems right now. We don't have implementation teams that are competent and functioning at various levels within systems. We have lots of other things that are part of human service systems, but we don't have the implementation capacity. So these new roles and functions and structures that are there to support the use of innovations by practitioners, organizations, and systems, that capacity has to be created. That's a big challenge. The other thing we have in human services, unlike business where you're making widgets, our innovations are interaction based. It's two people interacting with one another, or you as a TA provider interacting with a group. It's not like you're building a bridge or you're building a new iPhone wherever you left it last night, that's how you find it the next morning. Well, we encounter whole new things every day with the people that we're working with. So this mutual influence that is there is a major thing that also complicates our life as intensive TA providers. And the final thing is, and this is way too big a topic for our 30-minute university here, but here we are in systems where it's not like many manufacturing systems where they can shut down the plant, retool everything, and then open the plant the next month using the new, or to produce the new product. We have to do the capacity building work in the context of a system that is still functioning as it is. You're not going to send people home. You're going to say, well, all you people with substance abuse problems, we're going to close down for the next 2 months so we can retrain our staff, come back in September. That is never going to happen. So this creating the new while maintaining the system as is a huge complicator. The references across the bottom of this, and for those of you who get a copy of the PowerPoint, there's a whole reference section that has all this on there. But I really encourage you to read those just to see the intricacies of how that is done. So intensive work really is implementation work. Intensive technical assistance is really, if you want to think about that as implementation. And implementation science is a study of factors that influence the full and effective use of innovations in practice. So the full use of them and the effective use of them in practice. So the goal here for implementation and implementation science and research is not to just answer factual questions about how things are, but it's determine what is required. We love William Fage, and here's the person who was one of the leaders of the effort to eradicate smallpox from the world. Smallpox was a huge problem until 1979. 1979, Fage and colleagues at CDC and WHO had eliminated smallpox, and we don't have it today. But he said, you know, we need to go from asking what can we do with what we have, which is our typical TA kind of approach, to asking what will it take to do what needs to be done. And that's the intensive part. That's the making it happen part. And that's how they eradicated smallpox. So to help guide this, I mean, this is, as you just heard, a very complex process, start to finish. So what guides our behavior as intensive technical assistance providers? And what we would offer is the active implementation frameworks. Really provides guidance for the purposeful and effective action over many months and years often. So it's a way to be proactive instead of just reactive when dealing with all of these challenges. The active implementation frameworks, the book that's cited there is available. There's an e-reader book that you can get for like $9, so it's not prohibitive. But everything we have learned in the last 50 years is summarized in there. But the active implementation frameworks, the usable innovations, what is teachable, learnable, doable, accessible in practice, and that makes a usable innovation. And we said before, having these fuzzy, vague kinds of things that people are trying to do is a real impediment, and usable innovation is a way of getting around that. Stages of implementation. Everyone agrees that this does not happen overnight, but what are the stages, and what do you do early on that's different than what you do later on? And we'll quickly review some of that here in a minute. Implementation drivers, the drivers of change. As we mentioned already, behavior change is a big part of intensive technical assistance work. How do you organize yourself to bring this about in an effective and efficient way? Implementation teams, the capacity part. Who has the expertise to do this kind of work skillfully and effectively and efficiently? And that's invested in the teams. We have teams for all kinds of things, but we don't have teams right now embedded to really focus on implementation. Improvement cycles, we'll touch on this briefly as well. Anything worth doing, you start out poorly and you get better. But how do you do that systematically and efficiently? Systemic change. How do you build the implementation capacity into systems? How do you change systems that are currently functioning as they are, so you can help them create a new system to function in a way that actually makes full and effective use of innovations in practice to benefit whole populations. So the frameworks are there to help guide your activity as you're doing your work with a variety of people. So in the making it happen, making it happen means, again, the intensive support for change. But, you know, the first thing that has to change, it's us. We have to change how we do technical assistance. We have to become intensive technical assistance providers. We have to become experts in the use, for example, of the active implementation frameworks. So the first change is we change. But we do that so that we can help organizations change, and the organizations then help practitioners, and practitioners provide the benefits to recipients. So this making it happen really starts with us, and to make use of the kinds of skills that we're talking about here in this brief presentation. People say, well, where does all this come from? Well, it's very interesting in looking to see how change has happened in other systems. And Svensson and the group here, the resources needed to perform institutional work are created through the enactment of practice. So how do you get the resources to do these new things? You start out by doing these new things. And by doing the new things and people saying, oh, well, that is a better way of going about it. Oh, I see now the reasons behind all of this. Then more resources start coming your way. So there, as we mentioned, there intensive technical assistance does not really exist in the way that we're describing about here, and the implementation teams don't really exist. But once we get started down this path, then that attracts the kind of resources that are needed. So this enactment of practice, get ready, get started, get better. We say that 1,000 times every month. But the encouragement here is don't wait. Don't wait for some ideal set of circumstances that will help support intensive technical assistance. Start doing it and then attract the resources that you need so you can build your own capacity to do this work differently. So how is it different? And I just want to give you very brief examples of how intensive technical assistance is different from the technical assistance that we've all provided. And don't mistake this. The universal level and the targeted level, those are still critical. We don't want to give those up. They still are. It's still necessary to have people understand and become knowledgeable and aware of what's going on and to have more information about it. We just need to take it the next step. So this is not an either or. This is all of that and doing these new things. But for intensive technical assistance, it's not open enrollment. You can describe what intensive technical assistance is and the kind of change that's required in organizations. But that exploration and decision-making process is very different. So here it's always selecting organizations, not individuals. You're looking to make long-term, intensive is expensive, as it says there, change is difficult. We want this to pay off over a long period of time. But the people who have studied this, when you actually use the site selection process, and we'll briefly talk about that here in a second, you have more success. It costs less to achieve the benefits that you want. And in Norway, which is the Forgach, Tømmernes, and Ogden, where they've been doing this now for 20 years, there's whole generations of practitioners that benefit because the organization itself now is set up to bring in new people, have them efficiently prepared, and have the next generation of practitioners ready to provide effective services. So site selection is the very first thing that is a big change from how we do the rest of our TA work and how we do the intensive work. Here are the stages of implementation: exploration, installation, initial implementation, full implementation, and you can see some of the activities associated with that. But the exploration is really where you're deciding if this is something that can and should be done in an organization. So that site selection, organization selection that we just talked about, that goes on during this exploration stage. And exploration takes several months to get people together, have them really consider the use of the evidence-based program or other innovation, the kind of supports that are required, and so forth. Installation, this is where, okay, we've decided to do this. Now, do we have the resources to do it? Who's going to provide the training? Who's going to do the coaching? do we have the funding available to support practitioners making use of this? And so that's still a preparatory step. Initial implementation starts when the first practitioner is now delivering the evidence-based approach or the other innovation to the first recipient. That's the day that initial implementation starts. But you know how that goes. It is called the awkward stage. How do we say those words? Okay, we're going to use motivational interviewing. What are the steps again? How do I say this? I got the patient threw me a curveball on that one, so I didn't really know how to respond. You need to get through the initial implementation part to finally get to full implementation. And full implementation is where half or more of all the practitioners within an organization are making use of the innovation with fidelity and good outcomes. And so 50% or more. You'll see at the bottom, 2 to 4 years is the typical time that it takes to go from the beginning of exploration, you're first starting to think about doing this and consider the options, until you get to full implementation. And that's for those organizations that actually ever reach full implementation. And I can tell you from our experience and those of others, maybe 10 or 15, 20% ever reach full implementation to get to that 50% of people using it with fidelity. So the 2 to 4 years is not a recommendation, it's a reflection of the time that it takes to make this happen. But keep this in mind. I mean, this is part of intensive technical assistance work. This is part of the making it happen part of things. This is part of producing the desired impacts on populations in the way that we intend. It does not happen quickly, but here's a systematic approach to adjust your behavior as you go from exploration to full implementation with an organization. So here in the exploration stage, we all start out here. So here's another thing for intensive technical assistance. We call this the heptagon tool. But here are 7 things that really need to be considered during the exploration stage. And so what is the need for this? What is the issue that we're trying to resolve? How serious is that? And we put that first on the heptagon tool, because when you start making the changes that we just talked about, you want the practitioners to change, you want the organization to change the support practitioners, you want to help systems change. That becomes very uncomfortable for people at all of those levels. And so to help people get past that, this change is necessary so that this need can be satisfied. So having the need well established, what is the problem we're trying to solve? What is the importance of that? How pervasive is it? And so on. That's a critical thing to establish right from the very beginning. And surely that will change over time and you'll have more information. But having this be a consideration during exploration when you're first considering making use of evidence-based programs in organizations, that's a good place to start. Readiness for replication. I mean, do you know enough about this program and what it is that it's required so that you have a shot at doing it here in this organization or in this part of your system? So the readiness for the intervention itself to be replicated. Does it only exist in one article in a journal, or is this something that's been done dozens of times? Motivational interviewing is always an interesting one to look at what Bill Miller and the group did early on, where they were just taking it from the laboratory out into the real world and seeing, okay, what does it take? Evidence. Still want to have some confidence that all of this is worthwhile. But the evidence, to what extent does the evidence really line up with the need? If the need is great in this area, then the evidence for the intervention should say, if we do this intervention, then this need will be satisfied. And that is a critical piece of the discussion. Resource availability, people talk about that, but usually it's about money and that kind of thing. And resources here, well, are there people who would be good candidates for practitioners in this, using this program? Do we have the resources to do training and coaching with them? Do we have data systems and so forth? So the resources are beyond money. It's really the skill and the competence and support is what you're looking for. The fit, lots of discussion in the literature, as you all know, about fit. And so, but that is an important thing. Is this something that's like a lot of other things being done already? So it's not a big, bending of the mind to think about it, or is this something very different? In the early days, when so much of care for children was done in institutions, having the same services being provided to children in their own homes, home-based treatment, was a big change. That was a poor fit with the existing system. And so that was a consideration. Capacity to collaborate. All the things that we have talked about in terms of the changes required in organizations and systems, the more that the organization and system people are used to working with one another and coming to consensus decisions about things, sharing in the problem solving, all of those things would be a benefit. Capacity to implement being the last one of those. Again, your ability to do you have an implementation team already in place? Well, chances are not. So what can you do then to approximate that? But here in the exploration stage, this is where the selection of organizations that we talked about earlier, this is part of the selection of organization part. So this is not the typical paper exchange where you have a request, for interest on the part of organizations. They send you back something on paper. You look at it and say, yeah, that looks like it's a pretty good fit, so we'll go with them. That paper exchange is woefully inadequate when it comes to intensive technical assistance. Changing behavior, difficult thing to do. This is where typical TA falls slightly short of that. I mean, people do make use of it. They go find a way to change behavior, but here, in intensive TA, we're taking responsibility for that. And so I'm going to skip through some of that, but here are the implementation. I see Kim's on there, so she's going to cut me off here any minute. So but the implementation drivers, this over and over and over again is a well-organized way to help change behavior. Develop competencies, make sure that the organization is there to support people using those competencies in practice effectively and efficiently, and then having the leadership there to support it. Given the fact that Kim's going to cut me off, I'm going to skip.
I can give you 5 more minutes, 5 minutes.
All right.
5 more whole minutes.
All right. So, well, I'm going to back up then. So here I'll show you the little fidelity is a key part. This is a big change and a critical part of intensive technical assistance. Are we doing what we intend to do? How do we know? Is there some way of assessing that? And does it make a difference? If high fidelity is there, do we get terrific outcomes? If it's low fidelity, are the outcomes poor? And that's really the fidelity part. And our advice, there's this whole discussion about, well, do you adapt to adopt? The first lesson, as far as we're concerned, is do it as intended. What do you intend to do? What is the intervention that you have in mind. Can you do that? And we put in there if you can, because a lot of things stop right there. You're not able to do it even the first time. Only after you've done it as intended, only then would you consider changing it to improve outcomes. Too many times the intervention itself, the evidence-based program, the innovation is changed to accommodate, well, I don't like, I know it's a 12-step program, but those 6 steps I really don't like. Those 3 over there really don't fit well with what we're attempting to do. And so you end up with some version of things that is not going to be effective. And so that was my timer, Kim. So, and fidelity, just to give you a view, here's fidelity over a 5-year period of time, 5,000 schools. But you see in year 1 across the bottom, fidelity was pretty high for all 5,000 schools. But after 5 years, 42% of the schools had high fidelity use of the evidence-based program, the other 58% not. So fidelity is not something that you do once. It's not something that you can rely on being there forever if you have achieved it. This is something you assess frequently. And so this just gives you an idea how fluid that is. The other thing is on improvement. And the improvement cycles are critical. Whatever you start with, again, get ready, get started, get better is the mantra. But you want to improve innovations. You want to improve the implementation drivers so they're more effective, more efficient, fidelity and innovation outcomes. Consistency is a real problem, as you all know. So how can we reduce errors? How can we reduce omissions? And omissions are oftentimes more prominent than errors. More effective, more efficient, less time consuming, less costly, more usable, teachable, learnable, doable, accessible in practice. And the plan, do, study, act cycle is the improvement cycle. This is how you get started and get better. It all sounds pretty straightforward, but I can tell you that the fidelity of the use of the plan, do, study, act cycle is pretty low in practice. This takes discipline to do it. What is your plan? What do you intend to do? Can we carry this out? What happens when we do it? How can we make this better in the action part and then do it again? And the do it again part, where you have plan, do, study, act cycle, the cycle is missing even for people who are strong advocates of improvement. And the last thing is, here for improvement cycles, I cannot emphasize enough. Once you get started and you're trying to get better, really think about the plan, do, study, act cycles as a very conscious way that you want to go about it. The one thing we know for sure, if you don't try to get better, you won't get better. If you have 0 cycles, you will have 0 improvement. The wonderful thing, the data from other fields, it only takes about 5 cycles, 5 attempts at this to identify and correct about 80% of the problems. So just know that from 0 cycles to 5 cycles is a steep learning curve. It's your learning curve. But this is where you learn to do intensive technical assistance and do it well within organizations. So do this intensive work with a few selected organizations. Use the active implementation frameworks as your guide for the action. And hopefully you would be able to achieve the 60 to 100% success that you would like to see from our efforts. The wonderful thing about this is, as you develop your capacity, this capacity is something that is sustainable. this capacity is something that you can count on, not only for this particular innovation or evidence-based program, but for the next one and the next one. You notice I have not made this specific to substance abuse, because these principles that we're talking about here, we find to be universal. It is, once you have this, you can make use of it again and again and get better and better. And as I pointed out, it's all available in the book, and the references I talked about are all at the end of the PowerPoint. So I'm going to stop there, and I hope that was not too quick for getting an overview of how to go about this. I will point out the Global Implementation Society is a global group, just like your group. And here would be people who would be good colleagues for you on the implementation side of things. So thank you very much.